Live for the New York Times, and Ranu Dillon is global health physician at Harvard Medical School. Thanks to you both.
Thanks, Tanzina.
Great to be with you.
Support for the takeaway comes from Hint, water with a touch of true fruit flavor. Hint water is available in over 25 flavors, including watermelon, mango, and peach, with no sugar, sweeteners, or calories. In stores or delivered from drinkhint.com.
This is 90.9 WHYY, our NPR member station. Good afternoon. I'm Priyanka Tiwari. It's 12:20. Coming up on The Takeaway, we look at how the international community is viewing the Trump administration's response to COVID-19. And later in the hour, we speak to Ian Bremmer, president of Eurasia Group, about how the politicization of the pandemic in the U.S. compares to other countries' response to the crisis. We hope you'll stay with WHYY.
Supporting WHYY Cooper University Healthcare. Cooper reminds you not to delay your health care. Their team is ready to see you at their more than 100 locations in South Jersey and Pennsylvania. Cooper is taking the necessary precautions to help keep you healthy when you visit, with their full range of services from primary care to specialty care and everything in between. And weekend appointments at many of their offices. Cooper University Healthcare, putting your health first.
My friends, make no mistake. The greatest threat we face now is not the virus itself. Rather, it's the lack of leadership and solidarity at the global and national levels.
That was World Health Organization Director General Dr. Tedros Adhanom Ghebreyesus delivering a warning to international leaders on July 9th. As we just heard, the United States is struggling to contain COVID-19. At the end of June, the U.S. had 25% of the world's coronavirus cases, despite accounting for just 4% of the global population. That's according to data released by Johns Hopkins University. Recently, a number of countries that were thought to have their outbreaks under control have seen upticks in cases. The rates of cases in those countries pale in comparison to the United States.
Japan, for example, they have a much larger caseload than they did a couple months ago, and as a consequence, they're going back towards lockdown.
That's Ian Bremmer, president of the geopolitical risk firm Eurasia Group.
In Australia, you have one state right now that is going to put a high state of emergency on, and it shows that, even a little bit of people getting back to normal can lead to an awful lot of transmission of this coronavirus.
Ian told me that something setting our country apart from other nations are the political divisions that have emerged here around public safety measures like mask wearing and social distancing.
The fact that this has been politicized in the United States, that up until very recently the president himself was unwilling to proactively support and demonstrate mask wearing, even as his Surgeon General was doing everything he could to promote science, is truly unfortunate. It's obviously not displaying leadership internationally, and it fails the American citizens. So, look, when we look at the countries that have done a good job, it's not wealthy or poor countries, it's not big or small countries, it's not democratic or authoritarian countries. It's actually a bunch of governments that decided early that they were going to let the people with expertise actually lead the response, and they didn't politicize it. Vietnam would be an authoritarian state that did that well. South Korea, certainly. Germany, large, democratic. Norway, New Zealand, Greece, Argentina, quite poor, but also have been effective. There are actually, I could point to about 20 countries, Uruguay, but 20 countries around the world that have actually done an extremely good job, and they've had all of the things I just mentioned in your comment. They didn't politicize, they didn't cheerlead, and they got on it early, letting the people with expertise, letting the scientists, letting the doctors actually lead the response, because it's a pandemic. And it's a pandemic that we have no experience with before. So clearly, you're going to want people that have the best understanding of a massive healthcare crisis and how to respond to it and how to learn quickly and change your policy on the basis of that. You want those to be the people making decisions. And in the United States, certainly at the state level and the city level, it was very mixed. some good, some bad, some changing over time, right? But at the federal level, massive mistakes on that front being made by the administration.